The country's healthcare system has been hit hard by the USA's foreign aid freeze, with 35,000 workers now out of work. Non-government organizations are also raising the alarm about the fate of over 70,000 patients on ARVs who will be affected by the closure of 150 clinics offering HIV and AIDS management services. At the same time, government has now been challenged to bridge the gap left by the USA foreign aid freeze and save thousands of Kenyans from either losing their lives or regress in their treatment for HIV, AIDS, malaria and tuberculosis. Brenda Wanga reports.
Weeks after the USA slammed the brakes on foreign aid globally, the impact of that freeze in the Kenyan health sector is beginning to crystallize.
Over 150 clinics have been forced to close, affecting more than 72,000. And again, I repeat, affecting 72,000 people who rely on antiretroviral therapy.
The freeze has also seen the healthcare workforce decimated, with 35,000 men and women losing their jobs. While the U.S. government announced a waiver on life-saving activities, non-state actors in the healthcare sector say this has provided little relief and left out critical areas in the health interventions.
The children. When we miss a chance of testing a child and putting them on treatment, we can lose them in the first year of life. If we miss a chance of making sure that we stop the vertical transmission from the mother to the child, that means we are giving that child a lifetime of living with HIV. That is 70+ years of the government paying for ARVs.
That means that the patients who are likely to have had TB have not been tested because of that lack of that support. So what does that mean? That we have patients who have TB but have not been tested. So they are living among us and likely infecting others because of lack of that support.
In the aftermath of the aid freeze, the government has pledged to ensure continuity in the affected programs, but non-state actors now want less talk and more action.
But ever since the order came, and we know the impact of job losses, we know the impact of commodities we've lost, and we know the impact of interference and disruption that has resulted, we have not seen official government position commenting on this matter. And we have not seen the seriousness and the urgency on part of the government, because it is not enough to go and just assure persons who have HIV that there is enough stock of ARVs. Where there are job losses, you may have ARVs and there is nobody to dispense. So in as much as we are talking about a United States government's order, we are here also to talk to our government at the national and the county level to take the matter seriously and step in to address the gap, and also open dialogue with the U.S. government on continuity of services.
While the stop work orders have exposed the government's reliance on foreign aid for the provision of basic human rights and needs to its citizens, non-state actors are now calling on the very government to step in and ensure that these services, which are crucial and critical, are availed to its citizens without fail. Brenda Wanga, Citizen TV, Nairobi.